Kwa ningependa nichukue nafasi hii kumkaribisha tena rasmi Mr. Sajjad kwa ajili ya presentation. Karibu.
Good afternoon everybody. Welcome, and I know this is a difficult time to present everybody at a good lunch, although it was healthy, but we'll try to make it dynamic. So I'm here to discuss on a very interesting topic, and there are two topics that actually sell the most in Tanzania. I've been working as a writer for The Citizen. I'm a clinical pharmacist by profession, and the two topics that sell the most apart from entertainment is health and sports. And today we'll be discussing on health and technology. So I'll be covering three main things. First is diagnostic tools using cell phones. The second is telemedicine. And the third is public health education. You see, each of these topics are meant to cover the gap which we have currently in the health industry. And as our theme is today, internet can improve and change our lives. So the first thing we'll be looking at is diagnostic tools using cell phones. So there are almost 5 billion cell phone users in the world, and 70% of them are in developing countries. And as it was previously mentioned by Given, that people have more cell phones than toothbrushes in the developing world. And there are a lot of new tools that have helped that use cell phones for making diagnosis become easier and reach in rural areas. By a show of hands, how many of us have cell phones over here? Cell phones, everybody has a cell phone. How many of us has a microscope? I'm the only one who has a microscope over here. Next. So I'd like to introduce all to, as you can see in your screens, Lucas, the lensless ultra-wide field cell monitoring array platform based on shadow imaging. Very long word. Basically it means it is an attachment that you put on your cell phone that will allow your cell phone to act as a microscope. And what it does is, first of all, it's lensless, it has no movable parts, it's very portable, it's very lightweight, and it's much cheaper than a regular microscope. So what this does is, we use microscopes in medicine for counting red blood cells, white blood cells, to check the bacteria, malaria parasites, and all this is only done by the use of a microscope. Also, although we do have rapid diagnostic tests, but we still use microscope, blood smear for confirming malaria cases. And this type of system is what allows the microscope to reach in rural areas where it will be difficult to get a proper microscope in a health facility. Next. Okay, this is another thing. An ultrasound is a very important diagnostic device that we use in hospitals and healthcare facilities that is very expensive. And in a country like Tanzania, where majority of the people live in rural areas, it is very difficult to get these diagnostic equipments over there. So what's the solution? This is the solution. Having an ultrasound device that connects to your phone, whether an Android device or a smartphone, and it basically uses your phone and an application to conduct these diagnostic tests. Next. We also have applications developed these days for eye checkups, in which case you can just use your normal camera. In fact, any one of you, if you download the app, you can just take a photo of your eye and send it on the app, where a specialist somewhere in the world will look at it and tell you whether you have cataracts or not. So this also decreases the burden of specialists coming to rural areas or referring patients towards major hospitals like Muhimbili. Next. This is something very interesting. I want you all to take a good look at the screens in front of you. This is Nokia 3100, and what's attached to it is basically a modified headphone. The headphone has been modified to be able to listen to heart sounds. This is very efficient and useful for patients who have cardiac problems. One way we diagnose and we also look at whether a patient after heart surgery is doing well is by listening to the heart sounds and seeing the heartbeat and rhythm. So what this device is, you don't even need a smartphone. All you need is a phone that can connect through internet or multimedia SMS. So you take this device, you put it on your heart, and it records the sound of your heartbeat. Then you just send it to your doctor, and he will tell you whether you need to come for a visit or not. It decreases the logistics, the time it takes for a person to go towards the doctor, and basically it makes life much easier. It turns your mobile phone into a stethoscope. Next. So there are a lot of cell phone diagnostic tools, and many of them haven't reached Tanzania yet. But I'm hoping as we are continuing to move into the internet age and the digital age, these diagnostic tools would actually end up being more effective and reaching out to the people in the rural areas in terms of diagnosis. Next, telemedicine. This is something very interesting. We all shop online sometimes. We buy food online, buy grocery online. It's a very upcoming thing, online businesses, which will be talked about tomorrow as well when people discuss about internet and finance, mobile banking. But still, if you see in the health sector, we don't meet or discuss with our doctors online. That is something that is still lagged behind, not only in Tanzania, but in many parts of the world. So I'll be discussing about 2 applications that help with this. Next. One application is called Sana. So what happens is, if you look at Tanzania, there are very few specialists. For example, there are only 4 hematological specialists in the whole country. Only 4. And even less of other specialists. Neurosurgeons, they are very less. So what happens when you have a device like Sana? A normal medical officer, a GP or a nurse who are in good number in rural areas where there are no specialists, they look at the patient, they fill in the details in this application, and then wherever needed, they take photographs of the disease and they send it, they click send. Once you click send, it comes to a referral hospital where there's a specialist sitting on the computer. He goes through the information and gives a diagnosis or a treatment. If need be, referral happens. A lot of times we have seen people in the health sector complaining that wanasema wagonjwa wengi wanakuja Muhimbili, and this is a problem. So how do we solve a problem like this? Is by using applications like this. So only patients that actually need to come can come, and even those patients who are in other hospitals, Amana Hospital, Tumaini Hospital, they can still get the service by a specialist by using these applications. Next, same thing is Vula. Vula is another application that allows easy referral systems. They have actually used this application in India, where they have been doing early diagnosis and screening of people who have oral cancers. And they actually found that people have been benefited because they found cancers early and got treatment on time. So this is all I have to say for telemedicine. Next, the last thing which I'm going to talk about is public health education. Right now, everybody is complaining about the growing problem of non-communicable diseases. Yani magonjwa yasiyoambukizwa, like obesity, diabetes, hypertension. These are basically diseases that keep increasing right now. And how do we solve them? These diseases don't come today and go away tomorrow. They basically come because of our lifestyle. And basically they keep increasing because of the food, because of our diet, and because of lack of exercise. And over time, this is what happens. What I do together with some other healthcare professionals is we use social media and we use other platforms to educate the public on health. And it has been a very effective method because everybody has moved online this time. Kwa kumalizia, ningependa kutoa story moja ndogo. Nilikuwa bibi yangu kabla hajafariki, nilikuwa namwambia bibi usikule kalimati asubuhi. Kila siku asubuhi alikuwa nakula kalimati. Anambia kwa nini? Mbona mimi zamani nilikuwa nakula sina shida, nyewe siku hizi mnasema tukila kalimati tunapata kisukari. Mimi maisha yangu nzima nilikuwa nakula sina tabu. The thing is wakati ule babu bibi walikuwa na lima, alikuwa hamna trekta. Mpaka leo watu wanafanya, lakini ulikuwa ukienda na meli Zanzibar, unakwenda na ngarawa. Siku hizi maisha yamekuwa rahisi kwa sababu ya teknolojia. In terms of na gari, watu wengi wanatumia gari, hawatumii baiskeli tena. Wako watu wengi walikuwa wanatumia meli za Azam, hutumii ngarawa tena. So teknolojia imefanya maisha yawe rahisi. Na kwa sababu ya hiyo, ile amount of effort na exercise iliyokuwa imepungua, lakini watu bado wanataka kula kalimati ile ile. So this is where you see public health education, na basically to explain people on how lifestyle modification can avoid non-communicable diseases. Asanteni sana.